Ayurveda uses different terminologies in the textbooks which denotes food phobias. Bhakta dvesha or aversion to eating is one of them. Food phobia is considered as a bad prognostic symptom as per Ayurveda. Aversion to eating food is seen in conditions like bronchial asthma, parasitic manifestations, and in acute nerve pains like severe sciatica and all. Food phobia might be related to psychological factors as well. Another terminology used by Ayurveda is Anna Anabhinandana. That means food is not welcomed. It is commonly observed when the individual is angry, scared, depressed, or when having conditions like hatred or due to some mental disorder like bipolar, psychosis, etc. Annadvesha or aversion to food is another terminology. Ayurveda talks about it or about a specific dislike to a food in several disease contexts. The food aversions mentioned in Ayurveda may be a feeling of revulsion rather than an anxiety condition. We know that almost 70% of the pregnant women, they show some kind of food aversion to certain items. We know that we are the most adaptable species in the universe. The human body has a remarkable ability to resist disease process and to maintain our internal order and physiology. Ayurveda recognizes these unique capabilities and has documented the human body's cravings and apathy to different food items at different disease situations. The balance of Vata Pitta Kapha is the healthy physiology as per Ayurveda, while imbalance of Vata Pitta Kapha is the pathology. Our human body has innate capabilities of restoring the physiology or restoring the balance of Vata Pitta Kapha by creating phobias and cravings. So for example, if we have a joint pain which has increased due to an overexposure to cold, we can observe a natural aversion to cold exposure. And we can also see an affinity for warmer environment in such cases. Vata functions get imbalanced by increased intake of spicy foods. While Vata is impaired, the body will display an aversion or phobia to spicy foods and may display a craving to sweet taste. Vata imbalance can also cause phobia or aversion to bitter and astringent taste. Similarly, Pitta imbalance can result in an aversion to spicy, sour and salty taste. Kapha imbalance can cause a phobia to sweet, sour and salty taste. Vata Pitta imbalance cause an aversion to spicy and may result in a craving for sweet. Pitta Kapha imbalance shows aversion to sour and salty and favors bitter and astringent. And in Vata Kapha imbalance, there might be a phobia to cold potency foods and they prefer warmer foods. Not only in typical Vata Pitta imbalances, in a condition like jwara or fever, one can observe an aversion to sweet and an affinity for sour, salty and spicy taste. A food aversion, it could happen suddenly and ranges from foods you previously enjoyed. However, it is okay to avoid the food you do not like if you can replace the missing nutrients in your diet. Treating the underlying disease generally cures the food aversions and the phobias. Fasting, usage of carminatives and digestive herbs are also treatment modalities in Ayurveda for the food phobias. According to Ayurveda, most of the food aversions and food cravings are a self-healing mechanism of the human body to restore the Vata Pitta Kapha imbalance.